The use of performance-enhancing substances is not condoned in this video. Moreover, the information offered here is primarily provided for educational purposes only. Hello there folks, it's me, your fellow steroid enthusiast. I am here to talk to you about an amazing steroid you should try. Today, I will share with you all you need to know about the drug BPC-157. Now, you might be wondering, what is this? Above all, BPC-157 is a short peptide chain, essentially a piece of a protein. Its regenerative potential attracted scientists who are starting to investigate if this peptide may promote muscle and wound healing and counteract the toxic effects of common painkillers. BPC-157 likely promotes muscle and tendon healing by triggering the formation of new blood vessels, a process called angiogenesis. This explains its regenerative potential and why it might also help us heal wounds, cuts, and other types of damage in the body. Bodybuilders will often use BPC-157 as a healing agent for faster recovery and also recovery from exercises related to injuries, such as tendon injuries. Usually, tendon injuries take up to 2 months or so to completely heal. But with BPC-157, the healing process can take as little as 1 week. Furthermore, since muscles are healing at a faster rate, bodybuilders are able to utilize this and work out even harder in the gym. It is common for someone to squat every day of the week after using BPC, since it recovers the muscles so fast that you're able to hit the same spot every day. Competition bodybuilders that need to work out upwards 3 hours a day will use BPC-157 for quicker recovery and thus more gains. This amazing compound also has many potential benefits outside of helping musculoskeletal repair and recovery. It is currently being researched for efforts on neurological disorders, inflammation, and it has profound evidence for healing gut issues, such as lesions caused by non-steroidal anti-inflammatory drugs, NSAIDs. This is especially interesting because, with the exception of opioids, the primary medication utilized for chronic joint pain and other such ailments are NSAIDs. This class of medication is proving to have more and more side effects with prolonged usage by the population as a whole. If BPC-157 does indeed prove effective for not only healing the issues that were once treated with NSAIDs and corticosteroids, but also reversing or mitigating damage caused by them, it would be a vast improvement over these outdated practices. As it stands, there aren't a huge number of side effects associated with BPC-157, as long as it's used in reasonable dosages. A few side effects have been noted, but most of these occur early on during the usage stage when the body is becoming used to the substance. These are generally digestive issues, including things like queasiness, nausea, and mild illness. Taking it at very high doses can lead to some issues like irritation and unstable mood, likely due to an increase in the amount of cortisol the body produces. If you want to buy BPC-157, you should be aware of the dosage information because it has an effect. There is an abundance of research on BPC-157, and it has been shown to be effective systematically when injected once daily at anywhere from 1 to 10 micrograms per kilogram of body weight. In most cases, this comes out to a dose of anywhere from 200 micrograms up to 800 micrograms. Some folks report the most success dosing twice per day with 250 to 350 micrograms for a total of 500 to 700 micrograms per day. BPC-157 acts systematically. This means that whether you inject it subcutaneously, intramuscularly, or you simply spray it into your mouth orally. You know that saying that some things are better together? Well, that goes for BPC-157. What's been dubbed the Wolverine peptide stack is a combination of BPC-157 and TB500 or thymosin beta-4. While BPC-157 upregulates the growth hormone cell receptors, TB500 improves the speed of the entire healing process. Thymosin beta-4 and TB500 are in essence functionally the same. Thymosin beta-4 is a whole functional protein, and it has many effects on different tissues. TB500 is a synthetic fragment of that protein, and it is responsible for targeted tissue healing in muscles and connective tissue. Furthermore, it is advised to use BPC 157 in conjunction with anabolic steroids such as Debol or Androl when bulking, since it can drastically decrease healing time and thus give the user more gain with the cycle. That's all there is to it, you guys. Before deciding to use anabolic steroids, talk to your doctor. Until then, take care.